Hello, I'm Julie Miller from Focus on Dementia, and today I'm in conversation with Alan Murdoch and Nicola Hogg, who work in Shetland's Dementia Assessment Service. And they're my key contacts for improvement work that was undertaken in Shetland to test connecting dementia post-diagnostic support to primary care. So thank you both for joining me to chat about what's taken place there over the past few years. So Alan, you were involved in the project management of the work there. So for our listeners, can you tell me what being part of the programme helped you achieve in Shetland?
Well, in Shetland, we have a nurse-led assessment service for people suspected of dementia. We have support from a consultant psychiatrist in Aberdeen remotely. So we've been doing this for coming up on 13 years now. And we work really closely with primary care in that we got the bulk of our referrals come direct from the GPs who do a bit of workup before the referral comes to us. So we saw this as an opportunity to work closely with the GPs and helping to integrate the post-diagnostic component of the service closer to the primary care service. Previously, the post-diagnostic support was being provided by a range of maybe about half a dozen social care workers who were doing that as part of their existing role, and it wasn't really getting delivered properly. So we saw this as an opportunity to have a look at how that service was operating and try to do it differently and do it in a better way. So the assessment service we have here, as I said, it's ourselves as nurses who do the assessments. We get the referral from the GP, we go out and see the person in their own home. We then discuss that with our consultant at a weekly meeting, and we make diagnoses when we're ready, and we go back and deliver the diagnosis. So then we refer on to the PDS, and again at that point there was a bit of a kind of blip there because it was a referral had to go in for post-diagnostic support, which created a bit unnecessary paperwork. So we decided that at some point that it might be better for the PDS worker just to have direct access to the same databases that we are using, which was the database we used in the project, so that they were able to directly go in there and see, oh, somebody's been diagnosed here. I will now arrange to go and deliver post-diagnostic support.
Mm-hmm.
So I'll maybe hand over to Nicola now to kind of tell you a bit more about how she got involved in this project, because she came in to it completely new, really, having had a little bit of work in the previous service. So over to you, Nicola.
Thank you. Yeah, so I was one of those social care workers, the handful of social care workers that were initially delivering it in a different setting previously. And due to my passion for dementia, really, and sort of re-enablement sort of work that I sort of verbalised, I was picked to sort of be the PDS practitioner. And initially that was based in occupational therapy. And over a period of time of trying to sort of look at the project and what we wanted to do with it, I sort of felt, and I think we all did that were involved in it, that there needed to be a slight change in location, just purely because it felt like a more natural fit to be within the NHS Dementia Assessment Service. Still working with the council, of course, so I moved location and I sort of became working in the same office as the Band 7 and as the other nurses within the team. And it definitely helped, collaboration in terms of being able to access primary care professionals. I think just working in NHS land, so to speak, the service had a bit more credibility, but certainly I grew as a practitioner from just being immersed in all that information, as you can imagine, in the office, and learning about the pathway that came before the referral of PDS. So that's what I've been doing since then. And there's been a lot of improvements since that, a lot of practical support and advice for people living with dementia in Shetland, and really good improved relationships with not just OT, but also, the GPs, the physicians that we work with, whether that's regarding acute chronic illnesses or, the psychiatrists that we work with at Grampian. I feel like there's definitely been better relationships because of that move.
Yeah.
So, yeah.
Yeah, fantastic. And I think if I'm right, going forward, you're thinking about maybe having maybe 2 part-time workers in the role rather than it being sole practitioner reliant? Because I think that was one of the things we noticed, wasn't it, that sometimes just having one worker.
Yeah, so I kind of found that working as a sole practitioner, you know, for anybody who doesn't know, Shetland is not just one mainland island. There's a cluster of islands all around us, and there's 10 practices, 10 health centres. So you can imagine geographically for one practitioner trying to cover that whole catchment area, it can be quite difficult. So I'm actually stepping away from the role, and I hope to pursue my nursing career again after taking a bit of a break from my nursing. I've done my return to practice course, and I'm hopeful to maybe work in the dementia team in another capacity in the future. But what we've learned from me being in the PDS role is that it would be really great to have a sort of a team base from PDS worker to PDS worker, and really sharing experiences and supporting each other when supporting other patients. So yeah, but I'm also very grateful for the online support that I've had throughout the years. Obviously focus on dementia, but also the other PDS workers that I've grown to know through training opportunities and things like that. That's been a helpful peer support for me.
Yeah. And you'll be a great mentor for those other PDS workers that follow in your footsteps as well.
It's hard to step away from something where you've seen it working from the ground up. I think Alan will feel that way about, you know, the nurse-led service within Dementia Assessment Service in Shetland. Like, you know, you grow very fond of what you're trying to create. So I hope that when my career goes down a different path, I would love to try and support the future PDS service further by providing, like you say, that mentorship. It's really important, especially if you've been in the role previously. So yeah.
Well, thank you both so much for talking to me today, because it's so good to see that the PDS role in Shetland is being sustained, and we've now got so much to share with others who are looking to improve their models for diagnosing dementia based on the nurse-led service and all the learning from this. So if listeners want to learn more about this improvement programme, look out for other short videos and resources on our Twitter feed. But thanks again, Alan and Nicola, for joining me. So I'll let you get back to your day job. So thanks
very much.
Thanks. Nice to see you. Bye.
Bye, Julie.
Bye.
Bye.